Thank you so much, especially given the weather. We really appreciate you being here. We are very, very lucky to have as our speaker Representative John Larson. There is no greater champion in Congress for Social Security and for the Social Security Administration than Congressman Larson. And there's no one more knowledgeable about Social Security and the Social Security Administration than Congressman Larson. And we are so fortunate to have him with us today, not just here physically, but with us in our work to improve the economic security of all the American people. So, although Representative Larson represents the 1st District of Connecticut, which is very important, more accurately, he represents all of us. Representative Larson.
Well, thank you so much for that introduction, and I'm so grateful to be here with AFGE and all the work that you do for the citizens of this great country of ours. Now, Nancy was very laudatory in her introduction, but she's forgotten more than I'll ever know about Social Security. And as many of you know, was part and served on the Greenspan Commission. And so is probably the most knowledgeable person that we have on the Hill, not only in terms of Social Security, but also the impact, and as she indicated, the impact on SSA. And the lack of funding that has occurred there has been devastating. Consider this, and these are facts that you all know. 10,000 baby boomers a day become eligible for Social Security, which in the next year will surpass more than 70 million Americans being recipients. And at the same time that this glut of baby boomers coming through the system, we're experiencing direct cuts to the very administration and the very people that make Roosevelt's vision a reality. And what is that vision and reality? The #1 anti-poverty program for the elderly, the #1 anti-poverty program for children, until we finally make permanent the child tax credit, and for disability. Veterans rely more on Social Security. So who do they contact? You. You are the front line of Social Security. You are the ones that provide them. And how many people, all they want to hear on the other end of the phone is a human voice that understands them, not some computer-generated info ad. They want to talk to a person. And so that's why it's vitally important. I'm so proud of our Appropriations Chair, Rosa DeLauro, ranking member. We hope soon to be the chair of Appropriations again. And we've talked extensively. You can't move to expand Social Security and make it secure and in the same breath reduce the work staff that's going to require us to be able to accomplish those goals. Imagine, this is stuff you all know, we have not enhanced Social Security since Richard Nixon was President of the United States. 1971, I go, no, wait a minute, didn't we do something back in 83? Didn't Nancy serve? Yes, they did. That was about solvency. And Robert Dole convinced Ronald Reagan, who was adamantly opposed to Social Security, that no, this wasn't a bad idea because what they were going to do, and did back then, is raise the age. And in raising the age, as you all know as well, for every year you raise the age, that's a 7% cut in benefits. And their current proposal on the floor and part of their study commission in the House Republican Study Commission, I'll get to the Fiscal Commission in a second, they call for raising the age to 70. That's a 21% across the board cut. Americans don't know this by and large because the way they talk about it, they say, well, you know, people are living longer, and so if they're living longer, it just makes sense for us to raise the age. What they don't tell you is that if you're living longer, how in God's name does it make any sense for you to be living on less? No one in Social Security is doing extraordinarily well, let's say. $18,000 is the minimum average for a male recipient, $14,000 for a female, and as Nancy would point out, more than 5 million of our fellow Americans getting below poverty level checks from the federal government after having paid in to a program throughout their lives. That's not the guarantee that Roosevelt was talking about, but the only body that can change that is Congress. The president can't do it through executive order. It's nothing that the Supreme Court is going to rule on. Congress has to take action. And that's why I thank AFGE also for supporting Social Security 2100, which both expands benefits and also makes Social Security solvent into the future. And how? Extraordinary thing. Raising and lifting the cap on people over $400,000. Now, you're all aware that there's a cap on Social Security, and know it incrementally grows each year. And, you know, in my humble estimation, we should remove the cap entirely. But the president is right. He said in his administration he didn't want to see anyone, even though I would claim that Social Security is not a tax. It's an insurance policy. Says so right on your pay stub. Federal insurance contribution, FICA. Whose contribution? Yours and every American citizen that pays into this. This is not an entitlement, as they like to say. This is an earned benefit that you are in the forefront of protecting and providing people. This is Congress's fault, and I wish I could exclusively blame Republicans, but currently Democrats are united in both chambers. Different plans, but we're all together in terms of both enhancing Social Security and also extending its solvency. You can't do either of those unless you expand the workforce. The cuts that have been proposed, and most recently by the Republicans, a 30% cut at a time when Social Security is reaching its zenith in terms of the baby boomers who are going to be going through this process, it makes no sense at all. So I applaud AFGE. I applaud this panel that you're putting together today. This is precisely and exactly what we need, and we need to get that message across to every Democrat. I thank you for putting together all this data and information. I provide every member of Congress with a little Social Security card. And I say to our Republican colleagues, for those of you who care so deeply about tax cuts, why wouldn't you want to see 23 million Americans get a tax cut by no longer having to pay taxes on their Social Security? Why wouldn't you want to see the economic development that comes from every congressional district for all the individuals, on average of which it's about 130,000 per district, get direct payments? Where do they spend that money? They're not going out and buying stocks and bonds. They're going to the local drugstore. They're going to the grocery store. They're heating and cooling their residence. They're paying rent. And they're spending all of that money locally. Social Security is the greatest economic development program for our citizens that we can have and virtually every congressional district is impacted by this. We have got to make Americans more aware of this. Any polling data, when you talk to the American people, is off the charts in terms of where they stand with regard to cuts. They know they don't need any more cuts. They need the program not just sustained, but enhanced. It hasn't been enhanced in more than 53 years. That's what we're focused on. And we have a big threat, too, and Nancy talks about this, and I know you're aware of this so-called fiscal commission. I want to applaud Senator Wyden for his work on the Finance Committee and being so out front, also calling this for what it is, starting with the White House saying it's a death panel. And Senator Wyden say anytime you see that fiscal commission, it's a buzzword for cutting Social Security and Medicare. Imagine going behind closed doors in a body of 535 members, House and Senate, limiting that to 12 members and 4 non-voting members who will make a decision on Social Security and Medicare behind closed doors without public hearings on an unamendable bill that automatically gets an up or down vote on either floor. And you ready for this? Also has the money in it so they can sell the idea through the media before they bring it to the floor without a hearing, without a plan, just an up or down vote on what only 7 members have to approve. There is nothing more undemocratic than that, and nothing that is an insult to the republic that we serve than this fiscal commission. I commend Senator Wyden. I thank Nancy and Social Security Works and the more than 350 organizations who are rallying around it, including the AFL-CIO. And you know, it's heartening to see everybody out here, but we have to be vigilant over this next half year, because this is the kind of thing that can get easily slid in to must-pass legislation. This is something you all know and understand, and so I thank you again for your support and advocacy. Thank you for the panel and all that you will impart on us. Count on us for continued support. Lean into us and challenge every member of Congress to get this message out to their district. Make sure they all get a card. Make sure they all understand what this means to the very people in their district and how they're hurting the economic development in their districts and their individuals that they're sworn to serve. Thank you. God bless you. God bless America.
Yeah, feel free to now it's time for our panel. Oh. Great. And I am fortunate to be on a panel with 3 colleagues I so like, respect, and admire. So I feel very fortunate. I'm going to introduce our speakers in the order we'll be speaking, and then leave lots of time at the end for questions. So first we're going to have 2 people. Oh, excuse my voice. Let me take another sip here. So we're going to start with, and I'm going to do this quickly since I can get my voice back, but two people who have been serving the American people their lives. We're going to start with Jessica LaPointe, who's AFGE Council 220 President, representing over 27,000 employees at Social Security Administration. And then after she speaks, another SSA employee, Rich Couture, who's the American Federation of Government Employees Council 215, representing about 5,000 employees in the Office of Hearings and Appellate Operations. Both Jessica and Rich are representatives of the tens of thousands of dedicated and hardworking frontline and support workers, some of whom are here today either in person or watching online. And then after Rich speaks, our focus will shift from the viewpoint of the workforce to the American people. And you'll see we are very, very aligned. Kathleen Romig, our next speaker, is a leading national expert on Social Security and the extremely important companion program, the Supplemental Security Income Program. She currently is Director of Social Security and Disability Policy at the Center on Budget and Policy Priorities. Prior to her work at the Center, she worked the Social Security Administration, Social Security Advisory Board, the Congressional Research Service, and the Office of Management and Budget. And when she finishes, I will close us out and open it up for questions and comments. I'm Nancy Altman, President of Social Security Works and chair of a very broad-based coalition dedicated to protecting and expanding both Social Security benefits and the funding for the Social Security Administration. So with that, let me turn it over to Jessica.
Thank you, Nancy, for that introduction and for all the work that you do to protect Social Security and dedicating your career to it. So my name is Jessica LaPointe. I was hired into the Social Security Administration in 2009 at a time when we were arguably had adequate staffing levels and budgets to meet public demand. Shortly after this, the agency began to face a predictable set of circumstances that inevitably led to the crisis the administration, its workers, and the public we serve face today. In 2011, as Congressman Larson stated, the baby boomer population began to reach their traditional retirement age at a rate of 10,000 a day. Over the course of the last decade, the Social Security Administration has had to make some very tough decisions to meet the influx of applicants juxtaposed with dwindling budgets that cause reduced staffing levels and failing technology and equipment. Tough decisions like hiring freezes, reduced service hours to the public, eliminating employee benefits, stunting upward mobility, shortcutting training of our complex programs, and slow-rolling technological improvements and system upgrades. Now, after over a decade of beneficiaries rising by almost 25%, with operating budgets slashed by 17% considering inflation, and staffing levels reduced by 15%, and a steep decline in employee morale, we find ourselves in an untenable situation of poor working conditions that only congressional funding can solve. Snowballing employee attrition caused its lowest staffing levels in 25 years last year. We received some modest funding in 2023 that allowed us to hire and retain about 3,000 employees, but this is not nearly enough to dig us out of the backlogs that have accumulated over the years. Backlogs that are resulting in severe customer service delays that limit benefit access. Initial disability processing times have more than doubled in the last 5 years. It now takes 7.5 months to receive an initial disability decision with 1 million claims pending for a medical determination. Average wait times for public calls to the national 1-800 number have increased from 3 minutes in 2010 to now 36 minutes, without modern call features that announce how long a caller is waiting, and many callers get frustrated and hang up without service. There are 4.2 million items backlogged at our payment centers. Average wait times to get a disability hearing have increased from 4 months alone in the last year, going from 11 months in 2022 to 15 months in 2023. And today, it now takes, on average, 2.5 years to get a decision through the hearing level after initially applying. The employees tasked with carrying out the mission of the agency are facing mental health deterioration and burnout. 9 out of 10 say they know someone that has left their job due to overwhelming work stress. 8.5 out of 10 say they know a coworker that has sought therapy or medication to deal with work stressors. And tragically, 8% say that they know a coworker that has committed suicide linked to work-related stress. Due to the lack of competitive pay, benefits, upward mobility, and overwhelming caseloads, employee attrition is still higher than normal and worsening conditions for those that stay. The Social Security employee in field operations and across the agency work diligently to carry out the mission to pay the right amount to the right person at the right time. But right now, due to staffing losses and the lack of funds to replace, most days, despite our best efforts, we feel like we are failing. In 2023, it would have taken 29,300 claim specialists to complete the existing retirement, survivor, and disability applications. However, SSA currently only has about 18,500 claim specialists. That is 10,800 fewer than what is needed to process the public's work. And due to short staffing in all field office positions, the average claim specialist is doing the job of 4 workers. They are assigned to do public general inquiry and Social Security card application processing on average 65% of the work week. This is on top of being assigned double the claims that they can reasonably handle, including complex caseloads, and with limited dedicated processing time to get the work adjudicated. This is not sustainable. Overpayments have become a real problem and a source of frustration for our beneficiaries and the workers that serve them. $23 billion in uncollected overpayments could have easily been avoided had we been properly staffed to begin with. In the last 2 years alone, SSA overpaid 2 million beneficiaries. This is directly related to understaffing and at the root cause of it all, underfunding. There are simply not enough employees to keep pace with the number of beneficiaries reporting changes to their circumstances that affect proper payment. The Social Security workers have been blamed far too long for the current state of emergency at SSA that is disadvantaging our nation's most vulnerable citizens and putting them at risk for extreme poverty. The American Federation of Government Employees asks that Congress act now and begin to fund Social Security's operating costs to meet public demand. Lawmakers' constituents deserve timely service, and the workers that administer the program deserve adequate staffing, resources, and technology to get the job done. Thank you.
Thank you. Okay, my name is Rich Couture. I'm president of AFGE Council 215, representing hearings and appeals employees nationwide. And while I represent SSA workers, I actually want to direct my comments to the congressional staffers that are in the room. First, thank you for coming and attending and hearing what we have to say. But second, what we're proposing is actually going to help you out. Many of you either have in the past, currently are, or work with colleagues who engage in constituent service work. And I have to bet that one of the number one issues that you are receiving, either yourself or your peers are receiving, are phone calls complaining about the terrible service that your constituents are receiving back home from Social Security. I'm waiting too long on the 800 number to get a hold of somebody to help me out with my issues. Why can't I get my disability decision from the field office or from DDS? Why am I waiting so long to get my hearing scheduled and heard and to get a decision on that front? So the funding situation and the staffing crisis that we found has shifted a lot of the work that we do onto you, and that's not right. So while I would not presume to represent all of you, I am seriously trying to help you out here. We're in this situation, as Jessica had just compellingly stated, due to a convergence of several factors. We are the worst large federal agency to work for in the federal government, and it seems like in recent years that if SSA could find a way to go from 17th out of 17 agencies to 18th out of 17 agencies, it might find a way to do that. We have tried to work with SSA on cost-neutral and cost-savings measures that wouldn't impact the bottom line, only to be met with resistance or outright hostility to our proposals. And many of the things that we would like to see, because our colleagues in other federal agencies have these types of benefits, we hit the wall of, we're broke, we don't have the money. If we pay, if we provide greater pay or we provide more competitive benefits, that means we're not going to be able to hire the people that we need to share the load. So we are not in a position right now of being able to do more with less. We are frankly in a position of having to do less with less. And that's not acceptable to the people we represent, because we all joined this agency to serve the American public. And it, in some cases, and I hate to put it this way, and I'm not being flippant by saying it, literally kills some of our peers. As you heard the statistic about folks committing suicide as a result of work-related stress. Our people are hurting. The people that serve your constituents are hurting, and they need relief. I mean, I see some of my folks from the hearing offices in this room and the appeals council in this room who are crushed by more and more workloads being put upon them, more draconian work expectations being put on them, but they only work 8 hours a day. They only work 8 hours a day. Jessica talked about field office employees having to do the work of 4 people, and in many cases they're doing the work of 4 positions. It's a lot of our jobs at SSA have turned into Swiss Army knife positions, where we are expected to do everything, but we're not getting paid more to do it. We don't have things like other large federal agencies have, such as student loan repayment for people with qualified federal loans. We don't have child care subsidies for lower income workers like other federal agencies do. We at one time had a very popular vision assistance program to help employees who received vision issues as a result of using video display terminals, just sitting at the computer working on a screen all day. That was taken away from us in 2019 because the agency claimed it cost too much money. Our transit subsidies are not competitive compared to other agencies, and when we tried to negotiate an increase in those deals, the agency engaged in bad faith negotiations to avoid getting a deal that would give our workers who are eligible for transit subsidies a bigger and fairer benefit. That's not right. So what are we asking for? Jessica just mentioned that we had an overpayment situation to the tune of $23 billion. That could have been avoided very easily if we were properly staffed over the last several years. I want to make something abundantly clear, that a lot of those overpayments are not the fault of claimants who have reported their changes in circumstances timely, things such as income changes, work changes, resource changes, etc., that would cause and necessitate a change in benefit amount or even benefit eligibility itself. Fact of the matter is the overwhelming majority of the public who receive benefits report those changes timely, and our people simply cannot get to them. So then they get a notice several months down the road saying they owe an exorbitant amount of money to SSA, and they sit and rightfully say, why? This isn't my fault. I did what I needed to do. I told SSA what I needed to do. And then all of you, either you're getting the phone calls or your colleagues back home are getting phone calls at congressional offices asking for help. This isn't right. All of this could have been avoided if we had the proper staffing all along. So what are we asking for in addition to fully funded annual budgets, which will not solve our problems but will allow us to tread water? And I want to be abundantly clear. We're drowning right now. Every component at SSA is drowning. And by extension, that means the people we serve are drowning. So a fully funded annual budget is the least that we can get, or the least that we deserve in order to tread water. But we are asking for something else in addition to that. Very much like it was $80 billion that the IRS received under the Inflation Reduction Act. We're looking for a $20 billion supplemental funding package that would be $2 billion over 10 years to allow us to make up for lost time, to allow us to make up for the staggering amount of attrition that we've seen and the staggering amount of lack of competitiveness that we've had as compared to not just other large federal agencies, but also as compared to other sectors, other employers that can provide these things. More competitive telework, for example, is a big sticking point for us, as it is a big sticking point for employees across the country, across sectors. So what are we looking for? We're looking out of that $20 billion, $2.5 billion to increase staffing to 2010 levels. That was the high point that we had, and we have just gone downhill precipitously since then. We're not keeping up with the number of beneficiaries that we now serve, and that's a travesty. We're looking for $3.2 billion to help address pay upgrades. A lot of our position descriptions were written 20 to 30 years ago. They do not meet the reality or match the reality of the work as it is now performed across the agency. You know, as I mentioned, we have these Swiss Army knife positions like the claims specialist job in the field offices of the payment centers, the workload support units. I'm sorry, I'm going to try to avoid the abbreviations. It's an occupational hazard. We have, in my shop, in the hearing offices, we have GS-8 employees that are doing GS-11 work. When they first were put into these positions as legal assistants, in this position, the language in the PD, was drafted decades ago. The lion's share of their work was assembling these large modular yellow paper disability folders. Those don't really exist anymore. The work has become, it's all electronic, but the nature of the work itself has also changed. It involves, instead of a lot of that rote assembly of folders and exhibits, it involves a lot more technical analysis and independent judgment in the performance of the work functions. And since we now have a writing backlog, a decision writing backlog that has developed over the course of the last year in the hearing offices, dismissal work is now being shifted back onto our GS-8 workers. But the nature of the dismissal drafting, which had been done by attorneys for the last 5 years or so, has become a lot more complex, and the expectations for how that work is performed has become far more technical, far more complex, and my people are not paid enough. We need this additional funding in order to do that. We need this additional funding to take care of the folks in the field offices and the payment centers and the hearing offices and the appeals council. And on the 800 number in our data operations center in Wilkes-Barre, Pennsylvania, or folks in headquarters, I believe I hit all of our big components. I forgot the Office of Quality Review. I'm sorry. In order not to just get ahead, but to just simply accept what the reality of the work as it is being performed actually is. We need that money in order to, again, achieve those benefits that other federal agencies enjoy. At one point, we, SSA, took in federal employees from other agencies like the VA, like the IRS, like the Department of Labor, Department of Justice. We are now a donor to those agencies. I have folks leaving all the time to go to VBA, Veterans Benefits Administration, because the work is very similar, the positions are very similar, but the workload expectations are more reasonable. The benefits are better, and the pay is better. And that is exacerbating the situation that we're seeing with constituent services, with serving the public and trying to stay on top of these backlogs. Finally, two more things. We need $3 billion in order to address IT upgrades. You all know how terrible our 800 number is. You all know how terrible the phone systems are in all of our offices. The American public deserves better. So it's not just understaffing that is inhibiting service to the public, it's also the equipment that we use. And finally, we need additional funding to the tune of $2 billion for security upgrades, particularly for our field offices. Most field offices around the country do not have magnetometers or any sort of security measures to protect federal employees and the visiting public from those who would do harm to individuals visiting field office. It's only a handful of offices outside of federal buildings that have that type of security equipment and are staffed up with protective security officers to a point to secure those locations. And I don't think I need to tell this room that we are in a period of heightened sensitivity politically. Federal employees are often scapegoats and easy targets for displeasure with the government or with somebody's particular circumstances. And our folks, regardless of where they work, deserve to be more secure. So we need funding for that. And all of this is to address shortcomings that have accumulated, as Jessica said, snowballed, particularly over the last decade. So what we are asking out of this is to just get back to where we were, to get to where we should have been if we were funding our agency appropriately and commensurate with the level of beneficiaries that we are expected to serve. And I'll just conclude that our funding comes from FICA. Does not come from, the lion's share of our funding does not come from general revenue. Supporting us in this way is fiscally responsible. It will not add to the deficit, and in many ways, by avoiding and preventing overpayments from like the $23 billion that we've seen, would largely fund itself and provide better service to the American public, as well as make SSA a better place to work once again. Thank you.
Good morning. Oh, is that working? No, it's not. Does that work? Good morning. Does that work? Okay. I'm Kathleen Romig from the Center on Budget and a former SSA employee myself. Just want to talk a little bit, touching on some similar points, that Social Security is really the cornerstone of U.S. economic security policy. It is the biggest federal program. It touches the lives of nearly every person nationwide, from the 180 million Americans who pay into Social Security out of every paycheck to the nearly 70 million Americans receiving Social Security benefits. As Congressman Larson said, the program brings more people out of poverty than any other program, over 23 million last year. It's the biggest source of retirement income for most retirees. But it's not just retirement. It's also life insurance and disability insurance, and it helps whole families. In fact, Social Security brings over 1 million children out of poverty, more than any other program except the tax credits. As you all know, Social Security does face a real but manageable long-term financing shortfall. Because it's so important to so many people, it is critical that policymakers strengthen Social Security. They must do it in a way that keeps the program's promises to workers and beneficiaries and does more to protect people with low incomes from hardship. It is also so critical that policymakers support the important work that you do at the Social Security Administration every day. Nearly every American comes to SSA at some point, in person, on the phone, or using the online services. They do that at the best and worst moments of their lives. When they have a baby, when they get married or start a new job. They depend on your work to help them when they face a life-altering disability, the death of a spouse or a parent, or decisions about financing their retirement. They expect excellent service, and they have paid for that service. The money used to administer Social Security comes from workers' contributions to Social Security, but only if Congress lets the agency spend it. As you've heard for over a decade, SSA, Social Security applicants and beneficiaries have suffered from the effect of budget cuts. The cuts have shrunk the agency's staff and diminished its ability to provide the customer service that you want to provide. The cuts are the result of stringent discretionary budget caps that were passed in 2011. Since then, the customer service budget has fallen by 17% after inflation. The staffing has fallen over 15%, even as you've heard, the agency is growing by a record amount, by over 12 million beneficiaries over that same period, nearly 25%. And you're trying to do it at a 25-year low in staffing. The numbers just don't add up. As my kids say, the math ain't mathin'. Being forced to serve millions more people with fewer staff and resources has caused tremendous strain at SSA, and beneficiaries are suffering the consequences. Wait times for initial disability decisions are at a record high, as Jessica explained. It's over 7 months just for that first decision, often followed by a lengthy appeal. Hold times also hit a record in 2023 at nearly 40 minutes. And that's not even counting the people who hang up because they get so frustrated. SSA has a new commissioner, Martin O'Malley, and he's laser focused on cutting down on these unconscionable waits. But he can't do it without adequate funding. You can't answer the phone promptly if you don't have enough call center agents. You can't process disability claims more quickly on a skeleton staff. You just can't make real progress when you're facing this year's needs on last year's budget, or, as is the case now, last decade's budget. I just want to close by thanking you for your service. It's so important what you do every day, providing access to people's earned benefits and helping keep American families financially afloat. You deserve better, and so do those American workers and families.
For those that need to leave, we have packets for you that we'd like to give you before anybody else They're going to get that.
And then actually, I hope people stay, because at the very end we're going to ask people in the audience who are working for the Social Security Administration to introduce themselves, including where they work, so that staffs here will know who you are. So, as I said, we are focused on expanding Social Security, and that means both expanding the benefits and expanding the ability to access those benefits, which means opening field offices, expanding the number of employees at the Social Security Administration, better training, upgrading, and so forth, everything that's so important. As important as eliminating the shortfall is, which is Kathleen rightly and accurately said is quite manageable, as important as it is, it's a means to an end. The whole point of the program is to provide economic security. And then the question is, how do you best and appropriately fund that level of benefits and services? This is, we've been saying, and as the sign says, this is a matter of values, not affordability. Social Security is unquestionably affordable. If you look at a graph of Social Security's cost as a percentage of GDP, it's a flat line. It's essentially a flat horizontal line. It currently is about 5% of gross domestic product. At the end of the 21st century, it's something like 5.9% of gross domestic product. Again, that's about half of what most other industrialized countries spend on their old age retirement disability programs. There's no question we can afford and should be expanding those benefits. The same is true for the administrative expenses. About a half a penny of every dollar spent out of the Social Security Trust Fund is spent on administration. That level of administrative expenses is unheard of in the private sector. Private pensions spend maybe 5 or 6% of outgo. 401ks, a lot of those fees are hidden, but they're at least 10 or 15%. So all you have to do is raise that half a penny to a penny, or a penny and a half, and there would be plenty of money for all that we are talking about. The good news is that the American people are extremely united about Social Security. As polarized as we are, people overwhelmingly support the program. They do not want to see cuts. They believe the program is more important than ever. And it is the face of the government. As Kathleen said, the American people will have, first of all, they all apply. You need to have a Social Security card. We should be getting earnings statements so they see what they're receiving each year. But they are contacting the Social Security Administration more often, along with the post office, and it is the face of the government. So that is just another reason. Expanding it as a solution, Congressman Larson talked about the 2100 Act, which expands the programs across the board in targeted ways with no cuts. On the Senate side, Senators Sanders and Warren have a bill that expands benefits $200 a month and also restores Social Security to 75-year actuarial balance without asking more than 98% of Americans to pay even a penny more. In the case of Congressman Larson, it's only over $400,000, and in the Sanders bill, it's over $250,000. No one else pays a penny. They also, both Sanders and Warren had a bill and Larson had a bill in the last Congress, which is what the law really says, which is instead of going through the appropriations, since this is not an appropriation, it's a limitation on expenditures, the same way benefits are a mandatory expense coming out of the trust fund. The law clearly says that the administrative costs are also coming out of the trust fund, should not have to go through Congress. And they put a legislation in that said there'd be an automatic 1.5% outgo automatic administrative expense. If Congress wanted more, they could legislate more, but they couldn't legislate less. It's a long story why that came to be misinterpreted, but it's time either through legislation or through them just acting on the law to make that a reality. So let me conclude by saying that as Representative Larson said, there's an extreme threat to Social Security, which very few people know about, and that is this death panel that is being considered by Republicans and, unfortunately, some corporate Democrats. But there's no question Congress is going to legislate on Social Security sometime in the next decade. The question is, when they act, will they do it behind closed doors, or will they do it transparently so all of us can see what they're doing and hold them accountable if they, depending on what they do? And will they be representing their constituents, or will they be representing their donors? And we will all be able to see, maybe pretty soon with that commission. So with that, let me stop, and As I say, we have a few minutes for questions, and then I'd really like to go around the room and have everyone introduce themselves. So thank you very much. So should we start with the questions or should we start with introductions? What do you think? Anybody have a quick question you want to ask? What I say is, why don't we go to the introductions, and then if people have questions, raise your hand. So I think, Jeff, is that right? There's someone with a microphone. Or... Yes.
So we're going to go around if you're an SSA worker and say your name, position, and where you live. Yep.
Hello. Oh, great. I love that.
Stand up and you can look and see people. Yep.
Hi, good morning. My name is Sharona Guzman. I'm a Social Security retiree. I retired in 2021. Mostly because of what you were doing, describing the job. I love the Swiss knife analysis because that's how the work was becoming, and we were at home. Okay.
And where do you live?
I am from Tampa, Florida.
Great, perfect. So we're just going to do name, position, and pass along.
Morning, folks. My name is Sean Halloran. I'm president of AFGE Local 3342, stationed in the Syracuse, New York field office. We represent SSA field office employees, Central New York, Northern New York, and Western New York.
I'm Roy Porter. I'm a 23-year employee of SSA. I currently work as a claims technical expert in the Ogdensburg, New York Social Security Office, and I'm the executive vice president of AFGE Local 3342.
Angela DiGeronimo. I'm the New York Region Vice President with Council 220. I'm also the local president of 2369, which represents all offices in New Jersey. The New York region represents New York, New Jersey, and Puerto Rico and the U.S. Virgin Islands. And I am currently stationed at the Woodbridge, New Jersey Social Security Office as a claims specialist.
Hi, good morning. My name is Gregory Lalak. I'm a claims technical expert out of the Holyoke, Massachusetts field office.
I'm Jeremy Mask. I work in Des Moines, Iowa. I am the regional vice president for the Kansas City region, and I represent Iowa and Nebraska with Local 836.
Hi, my name is Leah Clark. I'm an appellate attorney advisor with the Appeals Council at Social Security Administration for the last almost 13 years. I'm also the treasurer and communications secretary for Local 3615, which serves individuals in a variety of places in the general region around Washington, D.C. and Maryland, and I'm a constituent of the Alexandria area, Virginia.
My name is Witold Skwierczynski. I'm a president emeritus of AFGE Council 220. I was president for 35 years. I retired in 2018. I'm presently chair of their retiree committee, and I'm a member of Local 3302, which is a Baltimore area local for field offices, and I reside in Catonsville, Maryland.
Good morning. My name is Keisha Felder, and I am a claims specialist in the Baltimore area office. I also serve as secretary for the Local 3302.
Hi, my name is Delia Trevino. I am part of Council 220, serving as the communications chair. I'm located in Temple, Texas, and I'm happy to be here.
Hello, I'm Iris Rakowski. I am retired SSA, recently retired first vice president of Local 2809 in Wilkes-Barre, Pennsylvania, but I am currently a district national organizer with the national office. And I am just going to make a quick comment. I see all our staffers are very young. Think about what our services are going to be there for your parents, your grandparents, and eventually you. But right now, your parents and grandparents. What kind of service do you want them to get? Thank you.
Hi, good morning. My name is Kenya Phillips. I am an employee of the Washington, D.C. Hearing Office of the Social Security Administration. And I am also the Chief Steward of Local 3610. Our local represents employees in over 5 states and several cities out of Pennsylvania, Delaware, of course, Washington, D.C., Baltimore, Virginia, and West Virginia. Thank you.
I'm Barry Sue Bryan, AFGE Local 2809, Wilkes-Barre, Pennsylvania. We have the Wilkes-Barre Direct Operations Center, which has about 1,400 people, 1,100 of which are bargaining unit, and we have 6 or 7 different components within our building, so we cover a little bit of everything. Thank you.
Good morning, Monique Buchanan. I'm a claims technical expert for the Social Security Administration Field Operations. I'm also president of Local 3239, which represents employees in southeastern Michigan in field offices and a teleservice center. Thank you.
Good morning. I am Taquan Murray. I'm the executive vice president of Local 4156. We cover Georgia and Florida. I currently reside in Savannah, Georgia, and I am a generalist, or whatever they want to call it now, specialist with the SSA field office. I do it all.
I am Ronnie Johnson, Local 3438 Vice President. I'm a claims specialist in the Montgomery, Alabama field office.
Good morning. I'm Heather Harris. I'm from Nashville, Tennessee. I'm an SSI claims specialist for 21 years. Yeah.
Good morning. I'm Sheila Tennille from Memphis, Tennessee, Local 3438, Treasurer.
Greetings from the state of Mississippi. I am Pamela Washington, State Designee, Local 3438. I'm a Title 16 claims specialist housed out of Greenwood, Mississippi.
Jimmy Votts. I'm fortunate to serve the public in Kentucky, and I represent, in my steward role, Kentucky field offices in the Atlanta region as a title of claims specialist.
Good morning. My name is Shonda Johnson. I've been with the agency for 15 years. I am a claims specialist in Tampa, Florida. I work in the workload support unit. I'm here representing AFGE Local 4156. We cover Georgia and Florida.
Good morning, everyone. My name is Juanita Dow. I'm with AFGE 1923, headquarters off. I represent headquarters and some of the field office in Philadelphia region. I'm a benefit authorizer. I've been with the agency over 23 years. Be going 23 this year, and I'm 6th vice president of the union. Thank you. And legislative political coordinator.
Good morning, everyone. I am Renata Davis, and I am a claims specialist for the SSI program, Social Security Office in Pensacola, Florida. And I'm also a steward for Local 4156, who covers Georgia and Florida.
Good morning, everyone. My name is Tamikia Johnson. I am also a claims specialist for 15 years and 9 months. Specialize in SSI the entire time. I am also the first vice president of Local 4156. We do represent close to 2,000 bargaining unit employees in the states of Florida and Georgia.
Good morning. My name is Misty Blackburn, and I also represent Local 4156 from Sebring, Florida.
Good morning. My name is Amber Westbrook. I am a Title II claims specialist. I work out of the Benton Harbor, Michigan field office. I'm also honored to represent my Chicago region, which is Michigan, Indiana, Illinois, Ohio, Wisconsin. And yeah, we're happy to be here today. Thank you.
Good morning, everyone. My name is Shanelia Ferguson. I am a customer service rep at the Fort Lauderdale Teleservice Center. I'm also the local president for AFGE Local 2014. We represent SSA employees from East Central Florida all the way from Titusville to Key West. Thank you.
Good morning, everyone. My name is Sherry Jackson. I am a resident of Connecticut, which is where our keynote speaker represents. I am currently Council 220 Second Vice President and Legislative Action Coordinator, and I also serve as Area 1 Vice President, which represents employees in Connecticut under Local 1164. I have been a claims rep since 2005, generalist, and I'm happy to be here. Thank you.
Good morning, everyone. I'm Shakanya Oaks. I am a teleservice representative for the last 27 years in the Baltimore Teleservice Center. I represent Local 1923 as a legislative coordinator as well.
Any questions? Miss anybody?
I think we got everyone. So, again, thank you all. First of all, thank the staff. I know it was a late night on the Senate, so we appreciate you being here. And thank you not only to the employees for the SSA employees for being here today, but for all the work that really is for the American people, and we would not be the country we are without you. So thank you, and everybody have I hope a great day.